Hi all, 7th European Conference of Aniridia in Stockholm, Sweden. 3 days of work to talk about the future of treatments on Aniridia and to get a better quality for the people with Aniridia. In this moment we are together with Chiara Ancona, who is a medical doctor in ophthalmology in the Fattebene Fratelli Hospital in Milan, Italy. Thank you for being with us.
Thank you for having me here. Good morning.
So, Chiara, yesterday you presented some interesting results about a survey done during last year and the first part of this year with some people with aniridia all around Europe in order to understand how they feel comfortable or not with the examination, with the medical doctors, with the treatment, with the surgical operations and something like that. All these questions just to understand how the narrative medicine can bring benefits to the people with rare disease and in particular obviously with aniridia. But we want to start from the beginning. So what is the narrative medicine and why is so important to consider it in order to get a better treatment for the patients?
So, narrative medicine is a new tool we have, and it is based on the consideration of the patient not only as the disease, so not only as the pathology of the body, but also as an illness. So we focus on the experience to be affected by aniridia and a sickness, that is the social experience to be affected of aniridia. So we focus not only to be affected by something, but also to live with something. So narrative medicine is a new approach and let us to try to understand the experience of illness and the care pathway of patients, but also of caregivers, and is based on a part of socio-demographic data, but also is based on illness plot, and is typical because it's based not on questions, but just sentence that the patient and the caregivers need to complete following their emotions. So we have just the beginning of sentence and the patient just need to complete it. So it's very easy to create an easy environment and to help the patient to express what they thinks.
So a good relationship between the medical doctor and the patient in order to better understand not only the feelings and the psychological state of the person, but also what they need to do for their pathology, symptoms and something like that. And what are the results coming from your research that could be interesting also for our audience in order to understand if they are right or not when they maybe are feeling not so comfortable with a medical doctor or an examination, for example?
So I think the most important result is to know the fact that the patient a doctor that can feel and understand them, first of all. Then I think what's important from narrative medicine is that us as a doctor, we are usually used to consider just the pathology, but we know to understand the patient and the problems. So from this project we understand the fact that there are some problems. So there is not a unique center of aniridia. There is patients sometimes can't simply find doctors. They can find humanity in doctors. So knowing the problems, we can improve it. So we can help patients to find the specialist for every type of visit they need. And we can help find some aid or financial aid sometimes, because it's not easy to approach every cost you need to in your life as a person affected by aniridia. And starting from that, you just can improve. But first of all, you need to know the problems, I think.
Sometimes humanity helps also the science, maybe it could be. And starting from your experience during the creation of this survey, what did you understand on aniridia and on patients with aniridia? There is something that caught you in maybe in a different way or somehow?
I saw that it's very different approach from the younger to the older. So the younger with the presence of Aniridia Europe, Aniridia Italia, and other groups just can find an easy way to live. And I found the older, more lonely people with a different approach to life. This personally, yeah.
This is thanks for this, because we want to do it. So we are a community. We don't want to be an island. We want to be something connected, like a network. And so it's so important also for us to have this feedback. And so what could be the next steps of this survey? So according to you, how to bring, what could be the advices to bring narrative medicine in the standard processes to treat a person with aniridia?
Narrative medicine can be used in every aspect of being affected, cure, or be a parent of a person with aniridia. But the fact is, thanks to narrative medicine, you can understand the problems and the experience of the others. And if you understand that, you can improve it. So you can manage to find some specialists for every kind, every aspect you need it. You can find cure. You can find the better cure in the better place. And I think this is very useful for the people, because if you can feel lonely, you can face it. So if you know that there are some place where you can go and find the right cure, is very different.